Dr. Cunningham.
Hello, doctor. This is Sandy Brown. I help prepare you for your disclosure conference.
Oh, yes.
Well, I'm also a part of the hospital's provider support team. We offer emotional support to providers who've had an adverse event. I'd like to talk with you for a few minutes, if that's okay.
Sure, go ahead.
Well, it's best if we meet in person, doctor. I'd like to help you work through some of the emotional stress I know you must be feeling. When would be a convenient time for us to get together and have a short conversation?
I really appreciate the offer, but I'm doing fine. And you know what? I'm really busy right now, but really, thank you for the phone call.
I certainly understand a doctor's busy schedule, but lots of physicians find it helpful to check in and see how things are going after a stressful event like they've had. Sometimes this kind of stress can take a day or two to incubate, and it can be a problem if it's not addressed early. Now, this isn't a required meeting, but I would like to take a few minutes of your time at your convenience and tell you more about how I think I could help you. Of course, it's up to you.
Okay. I have a few minutes now if you'd like to meet me in the small conference room on the 3rd floor.
Great, I'll be right there. Dr. Cunningham, I'm very sorry about what's happened to you. I understand this is the first time you've met with a member of our team, is that right?
Yes, I've never needed it. I mean, hell, in 12 years I've never done anything like this. So, what do you got?
Well, I wear several hats here at the hospital, and the hat I have on now is for the provider support team. We offer emotional support to providers who've had an adverse event in case they still feel anxiety or self-doubt about what happened.
Oh, that's right. I've heard about your group. Oh, by the way, thank you very much for coaching us to tell that patient about her error.
Well, thank you. I'm glad that worked out. First of all, you need to know this is not an investigation. No report's going to be filed. That's very important. This is a private meeting between you and me, and it stays that way. We know that bad things happen to the very best of us. I've had adverse events, and I know how unsettling they can be. I'm here because we care about your well-being. Do you have any questions about this meeting or my role in it?
Not yet, but go ahead.
Well, feel free to ask questions as we talk because I want you to participate. We got into the medical profession because we care about our patients, so it bothers us when something we do harms them. Please start by telling me how it's been for you.
Well, then you probably know that I almost killed a patient, that it was my fault, and hey, that's about it. I mean, it was at the end of a long day, and I had nothing else to do.
Well, we're not here to discuss the details of the case, doctor. I'm not gathering evidence or placing blame or fault. I'm here for your support, so let's focus on you emotionally. How has this affected you?
It's been hard. I mean, I'm ashamed I've been using the abbreviation for units, even though I knew it wasn't a good idea. I can't face my colleagues. I mean, they must think I'm a total idiot. This shook me, you know? I mean, I don't know if I should even be practicing medicine if I'm getting so careless. I mean, I find I'm double-checking everything I do. I'm doubting myself. I keep on replaying this over and over in my head, and I can't turn it off.
Something like this can really shake our self-confidence, can't it?
Yeah, it really does. I question my knowledge. I question my skill, my attention to detail. I used to be able to juggle a bunch of different things all at once, but now I question everything. It's frustrating.
And guilty?
Yeah, guilty, yeah. That's right. You said you've been through this yourself.
And something like this can cause a great deal of stress, to say the least. What about physical symptoms, lack of sleep or appetite?
Well, I haven't been sleeping the greatest, but I've been eating great. I'm back at work now, and so I could focus more on my patients.
And what about taking care of yourself? I mean, most medical training doesn't tell us how to take care of ourselves when emotional stress like this happens. What are you doing to lift your spirits, to take time for you?
I really don't have time for any of that.
Well, let's talk about that because your needs are important too. Unfortunately, most of us deny self-care.
Yeah, my friends say I do a lousy job of doing that.
Well, it may not seem like it right now, but you are held in high regard by everybody here, and your colleagues believe in you. So let's see if we can work this through together. Let's focus on slowing down and change. I want to spend the rest of this first meeting talking about self-care, appetite, sleep, exercise, social outlets. Does that sound like a good idea?
Yeah, okay. I'll see if I can make that work.
Good.